So do you have room 3022 for the day?
Yes, I do.
All right. Do you have time for a report?
I do.
All right. So the patient is a 22-year-old female, admitted from the emergency department from home. The admission diagnosis was a perforated appendix and a lower abdominal abscess. She had surgery initially 7 days ago, and then 2 days ago. The first time for the actual appendectomy, and then the second time for the clearance of an abscess and a small bowel obstruction. So also she initially was seen up in Green Bay about 2 weeks ago for the same abdominal pain, and they just called it generalized abdominal pain. And then she came here where they found the appendicitis. Past medical history: she had colon polyps removed, she has asthma, and she gets occasional migraine headaches. Procedures and treatments: so she's now undergoing IV antibiotic therapy with Zosyn. And she's draining via a wound vac over her central abdominal surgical line, and then bilateral JP drains. She's a full code. Her vital signs: she's pretty stable. Pretty much she's almost ready to go home. Pulse 68, respiration 14, 117 or 111 over 72. Pulse ox 99, temperature of 98.9. So her temperature is down as well. IV site: she has a PICC line. Her access is on her left arm. That's running just normal saline, and then right antecubital she's got normal saline and Zosyn. They're still just trying to get fluids up and everything. Procedures done in the last 24 hours. We discontinued her TPN and her NG tube. Both went off without a hitch. General assessment: her heart sounds are normal. Pulses, sensation in her extremities are fine. ANO times 4, lung sounds are fine. No shortness of breath, no signs of any asthma attack or anything. She last had a bowel movement at the end of last shift, and then some blood in the urine, but she's also menstruating currently. Musculoskeletal wise, she does have some back pain, but she thinks it's just from sitting in bed, so if she gets up and walks around, it goes away on its own. What else can I tell you? Skin sites, besides the suture lines and everything, are within normal limits. More focused. She's still mildly tender in the abdomen. Her surgical scar has the wound vac over it. The wound vac. What are the words I'm looking for? Basically the wound vac dressing is all good to go. Let's see, what else can I tell you? The JP drains. Yesterday it was the left was draining more than the right. Now the right's draining more than the left. Still serosanguinous. Really slowing down. I think in the last 6 hours it was only like 10 milliliters. Labs this shift. Her BUN went up from 6 to 7. Her calcium and phosphorus were both declined. Calcium was 7.8. Phosphorus 1.9. The physician thinks that it's from the TPN, so we're giving her dietary supplements. Her WBC is down to 13, and then her red blood cells and H&H are all three are declined: 3.3, 10.5, and 31.5. Slightly low, likely from the physician thinks likely from surgery, and also just since she's on her period. Current pain score is a 4 out of 10. Well, it was around midnight from a headache. And so we've been giving her Tylenol and ibuprofen just to help out with breakthrough pain anyways, and she's been sleeping since, so that seems to be fine. She's due for another pain assessment in an hour, and then we're still concerned about electrolyte deficits, and so we're just making sure that those supplements are working. That's why we have the repeat lab draws. Recommendation: we're just trying to get the electrolytes back up. If everything looks good from her labs drawn this morning, and the physician gives her the green light, she's out of here. So just making sure she eats her full breakfast, and then keep an eye out for lab results. And then her plan is to go home and stay with mom until she follows up with her primary.
Awesome.
Any other questions?
No.
Okay, cool.
Thank you.
Mm-hmm.